Hi, this is David Schaefer, the American Retirement Advisor. Today's segment is on selecting a Medicare supplement or a Medicare Advantage plan. In many areas, there could be hundreds of options available. How do you choose? What's the difference? Which plan's best for you? I'm hoping to demonstrate some of the differences and similarities between the programs and help you ask better questions so you can select the plan that's just right for you. If we look at original Medicare, it has two parts, Part A and Part B. Part A has no premium at this time. Part B has a premium, and if you're joining Medicare in 2011, it's $115.40 or more depending on your income. After we've made the decision to accept Medicare Part A and Part B, the next choice is we need to decide if we're going to supplement our Medicare or transfer our Medicare benefits to a Medicare Advantage company. So, to look at that more closely, if you have benefits from work, either as an employee or a retiree, you're probably going to need to have Medicare Parts A and B, but your plan description will tell you exactly. The other choice when supplementing your Medicare benefits is a Medigap plan. That is truly a Medicare supplement where you have Medicare plus your Medigap, and that does a really good job in eliminating any surprises in your medical costs. The other option is to transfer your Medicare benefits to a Medicare Advantage plan, and in many areas the benefits are extremely rich and very cost effective. The other option may not be available to you, but it's for folks with Medicaid. In many cases, the states will contract with a Medicare Advantage company to take those responsibilities away from the states so they can just pay one monthly premium to take care of you. So if we're looking at this as a whole, you can either supplement your benefits or you can transfer your benefits away. In the next slide, we'll get into more detail. As you can see, there are many companies that offer both Medigap and Medicare Advantage plans. Some companies offer just Medigap plans, while others offer Medicare Advantage plans. So really, what's the difference? On the next slide, let's look side by side at the major components of the programs. To compare and contrast Medicare supplements, that's Medicare and a Medigap plan, and Medicare Advantage, we really have to talk in generalities. Now, the green column is characterized by the supplements, and the blue column is characterized by the Advantage. If we look at the most important thing to many folks, it's the doctor. With Medicare and a Medigap plan, Medicare will pay any licensed physician, and any hospital for that matter, so you have no restrictions. As opposed to the Medicare Advantage plan, you need to make sure that your physician and your hospital is on the network. In metro areas, that's usually not a big deal, but for Medicare Advantage plans in the rural areas, you need to be very careful prior to using service because you may get stuck with a bill. When it comes to copays, the Medicare and Medicare supplement programs have no copay. They have no deductible and no out-of-pocket charges. The reason being is you're paying a monthly premium to make those go away. As opposed to Medicare Advantage, you would pay a small copay to see your primary care physician, maybe a little bit bigger copay to see a specialist, and maybe as much as $1,500 for a hospital stay. You'd pay 20 to 50% for a diagnostic test, but your out-of-pocket maximum for the year would be capped or limited at $6,700. Now, with Medicare and a Medigap, you need to get a prescription drug plan separately. That's Part D. D as in dog of Medicare. As to the Medicare Advantage plans, the drug programs are usually included. Now, why would somebody get a Medigap plan? Well, the most popular reasons are freedom of choice. Use any doctor, any hospital in the United States. You don't have to worry about copays or deductibles, and you don't necessarily need a referral to use a specialist. Now, the most popular reasons for somebody using a Medicare Advantage plan are typically premium, especially if you're in the rural areas. It can significantly save you money. Now, if you're in the metro areas, A lot of times, most all of the doctors and all of the hospitals are on the plan, so you can save some money on a monthly basis by selecting a Medicare Advantage plan. We'll get into the details of the pricing on the next slide. Now, just for clarification, the green column is Medicare with a Medicare supplement or a Medigap plan, and the blue column is Medicare Advantage. If you notice in the first row, Medicare Part A has no premium. That's assuming you've worked for 40 quarters in the United States and you've paid all your Medicare premiums. For most folks, there is no Medicare Part A premium. Part B premium is different for just about everybody. If you're turning 65 in 2011, your Medicare premium will be $115.40 or more depending on your income. Now, if we look at the Medigap premium, that's a guess. They range anywhere from $95 to $150 to $200 on a monthly basis. We're in Phoenix, Arizona, and we're very fortunate to have inexpensive Medigap plans. If you look at the right column under Medicare Advantage premium, that's also a guess. Again, in Maricopa County, Arizona, Phoenix, if you will, Scottsdale, we have very good programs with no monthly premium. On the left column again, Medicare Part D. That's also a guess. The average premium for Medicare Part D, that's the drug program, is about $35 a month. The programs vary all the way from $14.90 up to as much as $100 a month. And it's not so important what the premium is, it's how much are you totally spending on an annual basis for your drugs. That's another discussion for another slideshow. But if you take a look at the bottom line, at age 65, you can expect about $261 a month. That's for everything, for Medicare and a Medigap, for one person. On the right side, I rounded the $115.40 to $116 a month. That's also a very good expectation for a monthly premium. Well, thank you so much for watching. This is David Schaefer, the American Retirement Advisor. We really try to provide real solutions for today's financial challenges. If you need any help, please don't hesitate to call me toll-free at 877-220-1089, send me an email, or check us out at AmericanRetirementAdvisors.com.